Good afternoon. My name is Jacqueline Johnson. I've been a patient of Dr. Prima for several years.
Wonderful.
Um,
Awesome. And then tell me, what did you come to Dr. Prima for? What kind of symptoms were you having?
when I came to Dr. Prima, I was in very uncomfortable feeling. Uh, when I took a shower, I found a bulge and it was getting bigger and bigger and bigger. And it was very, very painful and hard for me to walk, sit, lie down. Let's not even talk about sex.
Yeah. And how many years have you been having these symptoms for?
Well, I didn't recognize the symptoms because I was never told anything about a prolapse, uterus, rectum, bladder. So I didn't realize the symptoms at first. I just thought it was menopause and I was just cramping. And then I realized once the bladder started to come through, I talked to my primary, and he said, I recommend you to go to a gynecologist, and that's what happened. And,
Wonderful.
Dr. Prima, the office made me so comfortable, so welcoming, even though I was very teary, I was very anxious, maybe a little demanding because I wanted it right now. So, I'm talking too much.
No, you're fine. Yes,
So
thank
Dr.
you.
Prima decided to give me another treatment while waiting on surgery because, due to the pandemic, they don't have that many slots for surgery. So I took the treatment, and then a month later, 2 months later, she performed the surgery.
Wonderful. And let me ask you, before you had the surgery, did you have any leakage when you cough, laugh, sneeze? Did you wake up in the middle of the night to use the restroom?
It was very difficult before I got the surgery. I couldn't even tell you how many times I went to the bathroom during the night. I had total constipation. I have leakage. Just at the end, I was scared to go out of the house just to go to the store because if I got the urge, I had to be near a bathroom or I would just urinate all over myself. I can't tell you how many showers I had to take a day. It was just awful.
Yeah, it does sound like that. And did you happen to use any pads or panty liners to help with the leakages?
I had to use pads because, first I started with liners and then it progressed to a thinner pad and then it progressed to a thicker pad. So it just went to the point where the pad wasn't holding the urine at all. So
Mm-hmm. And so once Dr. Prima saw that you had the prolapse and recommended the surgery for you, how did you feel?
when she explained to me what she was going to do and told me that not only, I had the prolapse uh, bladder, she told me that I showed a small but a prolapse rectum. And so she said that she would go in and fix everything.
Wonderful. And then how was your experience with the surgery? When you woke up, were you in any pain?
Well, I was not in any pain when I woke up. I was a little leery to leave the hospital on an outpatient, just because of my age, just because of family history, you know. So I asked Dr. Prima, to let me stay in the hospital. And she said, Jacqueline, you're just, a little nervous, you're a little scared, but, this is good. I know what I'm doing. What I'm going to do is lift your bladder, put it in a sling, fix the rectum, and fix the wall of the, vagina. So don't worry. I know what I'm doing. Just, relax, it'll be okay. And so that's what happened.
Awesome. And then once, let's say a day after your surgery, were you able to walk just fine, or did you go back to your daily activities?
um, when after the surgery, I wanted to stay later, but after the surgery, when I got up to, go urinate because the nurses asked me to, I realized then, oh, I'm ready to go home. I don't need to be here. So I went home, and I did. I kind of like rested, and so that I wouldn't fully get off into a regular routine, but I could tell just by walking in the house, I was able to walk without stumbling. I have other issues wrong with me, but that was really, really the most thing, because the bladder was almost out of the uh, vagina, and it made it very uncomfortable to walk. And now I told Dr. Prima, I said, oh, Dr. Prima, thank you so much. I said, I can walk again, and I can sit again, and I can lay in my bed. I said, I was just so uncomfortable. So I'm so happy that I was referred to Dr. Prima and the office. I just love all the girls here. They're so professional, comforting. This is the first time I had surgery that I had someone to call me after surgery at my home. That I can't tell you how much that made me feel, that they were concerned about how I was doing. So the surgery went well. I would recommend it to any woman, any age, to check into this type of surgery. It's no pain, none whatsoever. And like I said, you can go home the same day, and you can do pretty much the same activities that you was doing before. And I'm just happy that I've done it. And I keep repeating myself. I'm so sorry, but I'm just happy that I got it done.
Awesome. Well, thank you so much, Jacqueline, for sharing your experience.
Okay.
I'm sure a lot of patients will find this beneficial.
Okay.
Thank you so much
Thank
for your
you.
time.